Hey everyone, welcome to this podcast in 2026. And today I have the honor of hosting Stephen Keller. Stephen has been instrumental in shaping the dental insurance industry, first through his own business and then later on as part of DentaQuest. And now he's he's been managing a lot of and advising a lot of other companies on it. So welcome Stephen to the show.
Thank you. Good to be here.
So Stephen, dental industry dental insurance industry has gone through so many different challenges as well as evolution. You started, like, you're probably one of the first dental insurance companies. Walk us through where you were 40 years ago and where things are today.
Happy to do so. I went to dental school, University of Maryland, the first dental school in the world. Uh, uh, so we're there in the 73 to 77, and it was only 1973 where the federal government enabled HMO enabling legislation. So before then, there were no HMOs as we know them. So dental usually follows medical by about 10 years. While I was in dental school, I started thinking, well, dental is going to be next. Back then, medical inflation was probably 15, 17% a year. And HMOs offered the promise of we're going to keep people healthy and we're going to reward doctors for keeping people healthy with a capitated program. And they captured the imagination of the country. So they were the hottest thing. And I said, well, dental is going to be the next thing. So I got a dental school, bought a little home office. I lived upstairs. I had 4 operatories in 800 square feet in my basement. And about a year into practice, I said, well, I'm going to start a dental plan. Certainly not knowing
Nice.
anything, I figured let me go
Wow.
ahead and begin. So I'm in the Washington, D.C. area, and Baltimore, Washington beltways are about 40 miles apart. So I recruited 9 dentists, 4 around the Washington Beltway, 4 around the Baltimore Beltway, one in Columbia in the middle. And I had my receptionist at my dental office calling local companies during her lunch hour, and I was going to talk to them at my lunch hour. And that's how we signed the first few groups. And then I got some insurance salespeople involved who had their own agency. And they said, Steve, I think if this is going to work, we're probably going to need more than 9 dentists. So we continue to grow. And after we got to 20 years later, about 1,200 dentists, my company was the first acquisition of DentaQuest very soon after they became DentaQuest. And I was active with the NADP and knew a lot of people. So they asked me to head mergers and acquisitions for them. I helped grow the company from 2 million when I began with DentaQuest to 14 million through acquisitions, and then retired in 2009. Then when I did during that time, I did since 2009. I became an independent consultant. I helped them with a few more acquisitions. Helped a couple of other companies do some acquisitions. To consulting with other companies, and that's where we are today. So,
That's
but the
very
changes, yeah, we've seen the changes going from small companies where as an example, the National Association of Dental Plans originally was the National Association of Prepaid Dental Plans, and only HMOs were allowed to
Mhm.
participate. If you were a traditional insurer, a PPO, you were not allowed in. So over the
Interesting.
years, of course, that grew. But now we see the industry be after consolidation is a relatively small one. There are probably only 125 or 150 dental plans in the country compared to what we have on the medical side. And what's exciting to me is to see the universal ethic that I've seen in these companies is they want to make dentistry more affordable to go ahead and reach out and have more people have access to dental care because cost is typically the biggest barrier. Dentistry is very expensive. So good insurance makes good dental care affordable. And it's exciting to see all the technological changes that are coming about between CAD CAM and AI and all the changes that we're seeing. Uh, when
Impressive.
I was in when I was in dental school, just to let you know, the latest advancement was be able to do bonding. So that was a
Right.
technological advance back in those days.
That's really impressive background. I want to go back to, you said yours was the first dental plan. Now, is it similar to what, like if a dentist doesn't want to take insurance or has its own dental plan, like, hey, for just gonna pick a number, $250, so we'll give you two free cleanings and, you know, um, like two fillings or whatever. Was that how the plan was originally, or what was it? Tell me more about the original plan that you had.
Okay, the original plan was a capitation plan. So we would charge an employer $8 a month for a single individual. The dentist would get $6 of that $8, and we would charge $11 for a single plus one. The dentist would get $9, and we charge $18 for family, and the dentist would get $12. So
Wow.
now I know you're a technology company, and this may be a little boring, but back then we used to. My receptionist was typing up the list of participating dentists. We would send the dentist their monthly payment for the month of March, and it would list the 100 patients that they had with either the six, the nine, or the $11 that we'd be paying that dentist. Next month, there'd be some additions and deletions. If there was a deletion, my receptionist would white out somebody's name, the deletion, and then type in over that line the new member's name. So only the first list of members that a dentist had was ever in alphabetical order. If you can imagine
I
that.
I'm trying to picture that right now, typing
Yes,
using typewriters. So
yes.
over the last 30, 40 years, things have changed, but I feel like with technology, there have been more changes in the last 10 to 15 years. And I'm curious where you see the next 10 to 15 years would be.
Uh, well, certainly, I think that artificial intelligence is really changing everything. So, what we're seeing is that with AI, they're going to be certainly more predictive. They're going to take a lot of that redundant paperwork out that people have. They're going to automate these processes that are done manually with dentist recruitment. They're going to go ahead and get find out who is in other plans, do targeted marketing to those dentists, see what their fee schedules are, make sure the MPI numbers are in alignment. So I think that there is a tremendous benefit that we're going to see, in addition to the technology that we're seeing with reading X-rays and looking at. Going to my dentist recently, and he pulled up my bite wings on a screen, and it showed, hey, here is the bone loss. If there's any subgingival calculus, things are circled in different colors. So when we look at that type of technology, those are things that we couldn't have imagined before.
Yeah, no, I get that. Like like today there is like so much friction between member experience, um, provider experience, and then the payer operation. Why is that, and what is being done to change it? Because like insurance doesn't pay me, or I'm getting overcharged, or duplicate bills are being submitted. So there is all kinds of stuff happening. Like one hand is trying to not give it to other hand, and how what's going on? Where is this headed?
Well, hopefully in the future it'll improve. I think that the biggest friction out of those three things you've mentioned, provider experience, payer operations, and member experience, that the provider experience is still a key issue. I know recently published ADA survey said that last year 26% of dentists dropped participation in insurance plans. And according to the survey, 35% of dentists anticipated dropping plans during 2026. Uh, so more and more dentists are moving to an all private pay fee-for-service system. I'm in the Washington, D.C. area, the high-income area around the Beltway, and it's hard to find physicians who participate in Medicare and taking their fees. It's harder to find dentists who participate in those many insurance. And I think the reason we're seeing is that dentists are getting fed up with receiving lower reimbursement for procedures and then having to jump through hoops to get paid.
Yeah, it's so
So,
true. I mean, we
yes,
work with a lot of dental offices with insurance verification or claim adjustment or payment reconciliation and doing a lot of software development for a lot of companies. And we see that. And why is that though? I mean, I thought this was supposed to solve a lot of problems, but it looks like it's creating more problems.
yes. Well, 95% of commercial insurers rely on dental networks. So they look at increased management and oversight by them as lowering the costs. But by doing so, they're creating greater dentist friction. And I think that historically, it's almost an instinctive adversarial relationship that gets developed in dental schools. When I was in dental school and I talked to friends who teach in dental school, there's still that, while in dental school, that idealistic feeling. I'm the doctor. I'm going to school. Who are these pencil pusher insurance companies to tell me what I can do?
Oh
Who are
gosh.
they to tell me that I need to send in a pre-authorization? That's going to create doubt in my patient's mind until of my professional competence and honesty. And the fact is that we see a lot of dentists who participate with 10 or more different insurance companies. And
Yeah.
each of those companies have their own procedures, their own
Mm.
policies related to the same procedures. And I think that's one of the reasons why we're seeing an increasing number of dentists working for DSOs. They want to be dentists. They're trained to be dentists. They love dentistry, but they don't want to deal with all the administrative hassles. And we're also seeing, being that members are now paying more out of pocket and have greater, expenses on their own, they're becoming much more involved and much
Mm.
more critical of the care that they're getting. So one of the things that's lost is the fact that most dentists probably have 75% of their income coming from insurance companies.
Yeah, and it's
Uh,
the
Yeah,
reimbursement rates are like just all over the place, and like it just feels like there is this power. Like if I'm a DSO, I'm the only one in this area, I can command better rate. Or if I am one of the 500 members within Minnesota and I have only like, you know, two insurance companies, so I have to rely on them to give me leverage. So, I mean, there is a lot of that's happening. But, you know, you look at it from a payer's perspective, what, like, where can payers help out dental offices, or how can they help providers, and what are the things that uh, payers are underestimating or overestimating, not in terms of fees, but just the oral care in general, and how dentists can help their patients so that payers can then, you know, care it from that perspective. I understand payers have to have meet their bottom lines as well, but something has to give, something has to work. There's still that power movement, or talk about that.
okay. Yeah, and first of all, just to finish, as a family of four, they go into a dental office and just cleanings, exams. The kids may need a fluoride. In this region, I have grandkids who are going to. It's $1,400 or $1,500 for a family of four, and that's when everything is healthy. So
Yeah.
we need to understand that not everyone is going to be able to afford to go twice a year or routinely if someone's not paying the bill. Uh, and not in defense of insurers, but we're seeing the medical system and the medical insurance system not working very well. We're seeing over the last few years uh, that medical growth, annualized growth, was less than 1% for medical insurance companies, where the overall economy, it was 9% on most major
So
companies.
true.
So as a result of that system not working, and not being efficient, medical costs keep on rising. So typically $200 or $300 a month for many plans, and then employers are ironically putting pressure on the dental plan to keep their premium frozen or lower the premium. So over the years, working with very many large insurers and large employers, it's hard to believe when they're facing $200 and $300 a month medical increases that how routinely a company, an employer, will change dental plans because they can save $5 a member. So
I
you
hear you.
wouldn't think, so the pressure on the dental plan, hey, if I give an increase of $3 or $4 or $5 a month, then we may lose all 500 members in that employer group. And so you wind up squeezing that and, looking to get more burdensome, putting in more procedures, which is counterproductive as far as the
It,
dentists are concerned.
it is, and it kind of goes both ways. The dental offices are trying to find ways so that they can maximize the outcome, and then payers are trying to find ways to maximize outcome for themselves. And so, just pivoting, like if you were advising a dental payer CEO today, and they're like, hey, these are the three priorities that you recommend to invest in, what would those look like?
Well, certainly, I think number one, today is artificial intelligence. And it's not just investing, oh, let me buy some artificial intelligence and plug it in, and that's all we need. They really need to invest in their staffs and employees so the employees, instead of feeling threatened and sabotaging things, see the advantages of AI. And they need to invest in teaching their employees that they're going to be able to increase their capacity, have their job become more interesting, and become more productive. Um, Second, I think that we need to have them laser focus, CEOs laser focus on reducing their costs and keeping their premiums at reasonable levels in order to. And third, they need to create a system where dentists are identified in their networks if they're outliers, or as I like to call them, out and outliers, and go ahead, identify those dentists who are committing fraud, waste, and abuse, and taking care of those quickly, either coaching them, advising them, letting them know where they deviate, or that we're going to have a sentinel effect and we're going to be
Mm-hmm.
watching you. Because to deal with fraud, waste, and abuse by a very small number of dentists, I think it's probably less than 5%, that some companies are putting in place policies across the board that piss
Yes.
everybody off.
Yeah. No,
And
and that's
so,
true.
yeah, so all dentists and members shouldn't have to deal with that to overcome that. They should identify them and then go ahead and weed them out or coach them into not being outliers.
Yeah. Uh, you look at, I mean, AI will do a lot of different things and it will help, from an ROI perspective in dental insurance. Where are the areas besides that, what you just talked about, where there could be an immediate ROI? I understand fraud was one component, but it sounds like the size is fairly small. But you look at across the board, like there are a lot of AI tools available now. Uh, there are a lot of like evolution in terms of AI tools that's starting to take place. Where do you see dental insurance companies should look at very specific benefits that they could drive from it?
Well, certainly, I think the primary one would be an administrative savings in claims operations, which is typically their top cost center. Uh, so overall, the ROI can reduce touches that are going to have to prevent errors, minimize repetitive tasks for people, improve provider data and network integrity, especially with regulations around provider networks and listings that we have in provider, make staff more productive, and really help uh, avoid a lot of downstream work. So I think that's really the other parts, of course, standardizing reviews for
Yeah.
so they are consistent in their decision making, especially around medical necessity, because one reviewer will have one opinion, another reviewer will have another opinion,
So true. So
and
true.
it's so if there's some consistency in that, and providers know what they can count on. Hey, if I'm working with this company, this is what they're looking for. So we're going to go ahead and we're going to get the same response every time we submit a claim in the same way. It's not going to depend on who the reviewer were. If it's a similar, of course, assuming similar circumstances. Um, so I think that consistency is a big deal. And then, of course, I think it can unclog call centers by resolving simple things like eligibility and coverage questions that are tying up way too many human hours.
Yeah, and I suspect that in the future, or maybe it's here, the provider's AI will talk to the payer's AI, and then they'll figure out, right answer and right question. So, and I think we are eventually getting there. We're seeing like we as a technology company are building a lot of similar solutions for customers, and like lately it has been mostly AI driven. So, one, if you had a magic wand, what would be one systematic issue that you will change or you fix immediately in dental benefits plans?
Well, I think if we had to focus in, and I'm looking at outcome, we'd have developed a platform that was built on a technology that was designed to improve operations, drive down administrative costs in order to make dental insurance more affordable. So that is the type of platform that we need. And then, of course, if we look at the dental and medical integration, everybody's in their own silos, and we need to improve IT interoperability to get a more achievable systemic result that gives people greater access and knowing what their health benefits are and knowing how medical and dental mesh. Where over the years, again, I've been around for 45 years in the industry. They've been talking about medical dental integration for that entire time.
I
And
know
we
it's
still can't look at each other's charts, can't see the records, don't know what the patient's health history is. There are many areas that just haven't moved despite all the promise for 45 years.
interesting. So that brings me to the last question, and this is maybe a holistic question. Everyone have a different answer. Can you discuss like the issue of quality in dentistry? You've been a dentist and then you've been working in the payer side of things, so you've kind of seen both sides, and of course you are a dental patient too, so you've kind of seen all three
Yeah.
sides. So talk about where it was, where it is right now, where it should go, or where it hasn't gone.
Well, I love to talk about quality, Rajeev, and I used to do quite a number of lectures on it. And I always like to say that in dentistry, quality is the myth that dentists talk about as if it was real. I want to repeat that. In dentistry, I think quality is a myth that dentists talk about as if it was real. Because if it
I'm
was
puzzled
real,
now.
yeah, we would measure it, right? A Volkswagen can say they're as good as a Mercedes. There are objective criteria that are things are based on. And in the old days, in our capitation program, we would go out and inspect dental offices because we were directing members into those offices. So we would go and have a
That's pretty
consultant go
cool.
in. Yeah, and we look at how their charts. We look at how they're sterilizing things. We looked at procedures, and we would see dentists who didn't own periodontal probes. They had never done. You'd say, "Hey, where's the periodontal?" Oh, I could tell just by looking. I don't have to. I don't need a periodontal probe. Or we'd see the autoclave hanging on a hinge, and
Yeah.
so there's really no. So if we were interested in quality, as a
Hmm.
profession, as a guild that we are, we would have someone from the state board every 5 years, every 10 years, go out and inspect a dental office to see are they
Really?
sterilizing. Well, I think How else are you really going to look at quality? And if not, have diagnostic codes at a minimum, start to instill diagnostic codes, and then we can measure what outcomes are. Uh, I can tell you, as when I was, a dentist, I saw thousands of new patients over my career, and I'd have a new patient come in and say, "Oh, my dentist, Dr. Smith, retired. I don't know if I'm ever going to get used to another dentist. Dr. Smith was wonderful. The staff knew our names, our children's names." I'd look into the patient's mouth, the worst dentistry I've ever seen in my life. Crowns with open margins, periodontal disease, broken fillings, the worst dentistry I've ever seen. And then I'd have another patient come in and say, "I'll never go back to that dentist again. Dr. Jones, they were painful, every injections, hurt, the staff was rude. I'll never go there again." And that's why I changed. I look in the mouth, the most beautiful dentistry I've ever seen in my life. I'm saying, please give me the name of that dentist. That's where I want to go for my dental care. So you
That's
realize,
really cool.
yeah, patients, they know if they like you, what it costs, and
Yeah.
if it hurt. So
Well,
those are what patients know.
so 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 you talked about, I'm sorry, I thought that was my last
That's
question, but
okay.
it's interesting. You talked about that you would, as a plan administrator or the CEO of the plan company, you will go visit the dental office, then these other insurance companies would do so, and then the regulators would also visit. Is there anything happening now? None of this is
No,
happening anymore.
I mean, we used to visit, this was in the 1980s. We used
Yeah,
to
yeah, no.
inspect the dental,
Yeah.
but I'm not advocating that insurance companies do it. I think that uh, there's no one who would agree that insurance companies are the ones doing it. I think the state boards, typically, if I had my druthers, would be the one who would do that because that's the only one that's going to be an unbiased source. People are not going to go with insurance companies going ahead and do that because right now, you graduate dental school, and for the next 40 years, you're good enough for us.
Yep.
You graduated, you pay your dues, and that's all that's all we need. Yeah. Ironically, there was a Reader's Digest study about 15, 20 years ago, an article along with other ones done by University of North Carolina. Uh, but the one at University of North Carolina, they had two patients go out to see 10 different dentists with all of their x-rays. And they told those dentists that are being part of this study, they wanted them to go tooth by tooth, tell them what they found and what treatment they would perform. So they knew they were in the study. Nobody was trying to, kid them. They were all seeing the same x-rays. Um, Patient one, the treatment recommendations range from $400 to $6,000.
Wow.
Patient two, the treatment range was $250 to $4,500. So you'd go tooth number two, a dentist said, no, fine. Tooth second, another dentist, no, it has to be filled. Another dentist that we need
Yes.
to. So there
That
were
is
very
cool.
few teeth that dentists even agreed, did it have decay
Yeah.
or no decay? Should it were filling be replaced? And if it did it need an amalgam, composite, inlay? What did the treatment do? So the conclusion was, of course, is that dentists are free to make any decision they want based on whatever they see is
Yeah.
best.
It's very telling.
So there's no standard guidelines of, so when we talk about quality, when you say it's in the eye of the beholder, it's in the eye of the dentist, who is a totally independent body who has no guidelines to go by. There are no standards in dentistry, there are guidelines. So sort of anywhere in between here is good,
I know.
anywhere there works.
That's so true. And I'm not for like right regulation is what every industry needs. Less oversight from a government agency. I mean, just enough so that, for our patient, the quality of care improves. That's enough. But I'm a big proponent, like when I go to a hotel and then go through the elevator, on the elevator there is this sign that says this has been inspected, right? It gives me a feeling that the elevator is not going to drop and then I'm going to be dead, right? I am
Yes.
sure there is something similar that could happen or has been happening, or like that's the direction that could be there. I don't know for dental offices, medical offices in general, all practices, all types of retail health practices where treatments are patient care is being taken care of. So no, I get what you're saying, and I think there is definitely some room for improvement. But I want to thank you for being here for the podcast.
Thank
And
you.
I really appreciate that. And uh, I know you're retired and you're helping improve the overall, pair industry. So good luck and continue to do all good work.
Thank you. Thank you. You have a good day.
You too. Bye.